अस्सलाम वालेकुम। अस्सलाम वालेकुम, सुन रहे हैं कोई भी?
Walaikum salam.
हाँ, कैसे हैं?
ठीक है. I'm going to mute everyone so that we can
What is it?
so we'll be starting shortly.
इंशाल्लाह, इंशाल्लाह। बिल्किस ठीक है घर में?
Assalamu alaikum. Thank you for joining. Just give us a few more minutes and we'll get started.
All right. Assalamu alaikum, everyone.
Walaikum salam. So Dr. Siddiqui has joined our session, and if you have any problems, questions, or comments, just open up your chat box, and that's the best way to get them to us. I will be checking it periodically. So let's go ahead and get started. I'd like to begin by thanking Dr. Anwar Siddiqui for doing this session. And just a few quick housekeeping rules, and then we'll get going. So like I said, welcome to Dr. Siddiqui. Dr. Anwar Siddiqui is an infectious disease specialist within the Premier Health and Life Care Hospital systems. He's been practicing in this region for the past 20 years. Part of his past experience actually includes working at the CDC as an epidemiologist for the Division of Respiratory Viruses, way back before there was anything called coronavirus. He's been an integral part of the ICGC community, and he lives here with his wife, Saima, and his two sons, Samir and Zohair. Once again, we'd like to thank him for putting forth the effort and doing this presentation. He did one 2 weeks ago when this was all beginning, and now we're gonna see where things stand now. Just so you all know, the session will be recorded, most likely uploaded to our ICGC YouTube channel. And once again, submit any questions you have via the Zoom chat, and I will keep an eye on that. So unless anyone has any questions, and let me just take a look and see, I don't see anything from the chat. So can someone just send me a chat and let me know that they can hear me or not? Okay, perfect, thank you. All righty, so that being said,
Well, I want to thank you, Dr. Sohail, for the wonderful introduction. And I also would like to thank the members of the board for the Islamic Center of Greater Cincinnati for making this opportunity available for everyone. As you're well aware, we're going on into past 90 days ever since we started to hear the word coronavirus, and then later on COVID-19. I went through a lot of background and the history for the last 2.5 months or so back on March 14th. So today we're going to have a different format, and we're still open to any questions that will be coming from you. So if we can go on to the first slide, Dr. Sohail. Where do things stand as of April 3rd? As you can see, I'm going to start off with the cases here in Ohio. March 14th, we had 26 cases, and as of yesterday afternoon, we had 3,312 cases associated with 91 deaths. Pretty much there are 88 counties in Ohio. This data is coming from, there are about 12 counties that have yet to see. These are relatively remote. So it is spreading fast here in Ohio, though our governor, Mike DeWine, and his force, his task force that's behind him, Dr. Acton, they have been instrumental in enforcing some of the rules and regulations that have helped us prevented us from being in a situation where New York City is right now. So globally, just to give you a perspective, as of yesterday, there were 1.140, so 1.4 million cases with over 60,000 deaths. In the entire United States, there were 277,000 cases with over 7,000 deaths. In Ohio, we have 3,300 cases with about 91 deaths. If we can go on to the next slide. This gives us the representation of the counties, 895 hospitalized, 91 deaths. These numbers are increasing every day. We can move on to the next slide. This is an interesting one. You've heard the term flattening of the curve in the media from various sources, and I want you to focus on the yellow part of the curve. If you notice, on the March 15th, March 22, had nothing been done in terms of social distancing, the different public health strategies, this is where we were projected to be. These data are done through different models at Ohio State University. The statisticians, epidemiologists have been working on it. So these are dependent on the data that they have. So had nothing been done, we would be at over 50,000 cases sometimes in mid-March. However, with the strategies that we have currently in place and trying to flatten the curve by our simple things like social distancing and stuff, we anticipate a peak sometime after mid-April, April 19th, when they're anticipated to be about 10,000 cases per day. So we need to be prepared for that, and we'll be going over different strategies. Just to give you another overview, can we move on to the next slide? In terms of epidemiology, we have an age range from a couple of months to, I found out there's now another case, this is from 30th March, but now there's a case in 101-year-olds. So there are cases from anywhere as young as a couple months to 101 years with a median age of 53. It's pretty much equally distributed in terms of gender, almost 50-50.
So thank you, Dr. Siddiqui. So just from looking at the curve, the question that arises is this social distancing making a difference? And I think you have shown us what a true huge impact it is really making. Are there any new recommendations of things we should be doing? Should people be wearing masks every day? Somebody's saying something different. So where do things stand with that?
Okay, so as far as social distancing, that's absolutely, it is working. Again, the recommendation is 6 feet apart, trying to stay home as much as you can, going out only if needed. These simple measures have definitely made an impact and towards the goal of flattening the curve. So it has worked. Are there any new recommendations? I want to just reinforce just a couple of things. Can we move on to slide number 9? And that kind of helps us. There we go. As far as the first one, how do we spread? How does coronavirus spread? You're all familiar, coughing, sneezing, coming in contact with objects that have potentially been contaminated. What can we do? The first 3 things that we need to do: wash our hands. Number 2, wash our hands. Number 3, wash our hands. I mean, this is one of the most important things we can do in prevention in any type of disease, including the COVID-19. The third part is avoiding close contact, and that's where the social distancing piece comes in. We are stay at home when come out only if needed. Some of the new recommendations as of the last 24 to 48 hours that have come from the Centers for Disease Control are the wearing of a cloth mask. This can be a homemade mask, this can be a bandana, but covering the face and mouth. And the rationale behind this is that we are trying to prevent this virus from spreading to others. Remember, one can be asymptomatic. One can be not exhibit any symptoms and yet have the virus. And the whole idea behind this cloth mask is to prevent it from being spread to other individuals when they cough or sneeze, or even talking. Next, we have to cover our with either a tissue or an elbow. This is the recommended when you are coughing or sneezing. And then I want to make a point about just in the household setting, cleaning and disinfection. For those of you, we unfortunately ran out of our Clorox wipes, but there are other alternatives. There is, you can make a simple solution of 1 gallon of water with 1/3 cup of bleach, and that acts as a reasonable disinfectant to wipe surfaces, doorknobs, handles, or anything that could potentially have come in contact with somebody who's infected. Another option is to have a 70% alcohol-based cleanser. Then, that again is good to eradicate or prevent this virus from further spread. The EPA, the Environmental Protection Agency, has a whole list. You can go on their website. There's a whole list of disinfectants that could be potentially used at home to further prevent transmission.
Thank you, Dr. Siddiqui. I think if there's one image that we need to ingrain is really this one. If we can do all of these things, we know we've really done our best, inshallah. So moving along, when you see the media, there's just so much stuff out there. Are there new symptoms that were not recognized 2 weeks ago? And what's really confusing to many people is initially everybody thought it was a mild disease and you'd get better, but then you're hearing of young, healthy people dying. So is it really just a disease of elderly and immunocompromised, or where do things stand? Just maybe shed some light on these questions.
Okay, just to recap on some of the signs and symptoms. Fever and cough seem to be the predominant one. Approximately 99% of patients who have the coronavirus, SARS-2, or the disease COVID-19 will exhibit a fever associated with the fatigue and typically a dry cough, as opposed to a productive cough with phlegm or sputum. So dry cough, fever appear to be the most common symptoms. We can have fatigue. There could be lack of appetite, generalized myalgias, body aches, shortness of breath. That's where we need to be careful. If the shortness of breath starts to get worse, this is where we may need to seek further help through starting off with your primary care physician. It's been described now that maybe initially one can also experience anosmia. In medical terms, anosmia, or this is the term for loss of smell. And loss of taste. These are two symptoms that are being recognized more and more in some of these patients. So your next question is mild versus severe. So like I said, there could be some asymptomatic cases. We are finding people who have been exposed, they're asymptomatic, especially the young, maybe the teens, they could just be asymptomatic and become carriers. So the things that we emphasized on slide 9, it's very important to be following those. And we will discuss that a little bit further, specifically for people who are wanting to go and get out. So there are people who exhibit just mild symptoms or no symptoms at all. When it comes to severe, that's where the shortness of breath, if it's getting worse, people can have night sweats. In the middle of the night, they get up with high fevers and difficulty breathing. That is where they need to perhaps seek help with starting off with a primary care physician. Your third part of your question is this a disease of the elderly and immunocompromised? My answer to this would be, it tends to exhibit severe symptoms in the elderly and immunocompromised. These are patients, people potentially at high risk with having severe symptoms of this disease and requiring hospitalization. So we have to be cautious. If we have elderly people, we need to check up on them, stay in touch. Immunocompromised, when their immune system is not working well, there could be a number of reasons when a person could be immunocompromised. They could be on cancer chemotherapy, or they could be on a whole host of drugs, medications that can suppress the immune system. So these are people who tend to have worse outcomes.
And here's a question: who's considered elderly?
Good question. I guess one could use 65 and above, but honestly, a 45-year-old with severe comorbidities such as diabetes and heart disease, would be equally at risk. So, it just depends on the individual.
Okay. So another big question that comes up is, who should get tested? When should they get tested? How do we get tested? Where do things stand from that front?
Okay, excellent question. As you know, you've been tuned into the media. The testing piece has been somewhat slow here in the United States in terms of even when people have been tested, the results have been, it's taken 5 to 6 days to get the results. But this past week, we've been able to, locally at least, there are several labs now that are able to provide the results within 2 to 3 days. So this would assist in screening. Now, who should get tested? I'm going to go back to what I said before. People who are asymptomatic obviously don't need a testing. People who have mild symptoms, they have symptoms of just a common cold. They have a slight fever, and they have a cough, and they have the sniffles. Remember that we're in the peak of spring. I mean, we have these pretty white blossoms all around the communities in Southern Ohio. And this also tends to be the peak of the allergy season. So we have to be able to differentiate what is an allergy, typical allergy, and what is a true COVID-19. And this can be hard, but anybody coming in with the sniffles, a little sore throat, and a runny nose does not need testing. Remember, our resources are limited. So patients who actually exhibit the whole triad or 4 or 5 symptoms that I listed earlier, fevers, cough, myalgias, body aches, shortness of breath, they are the ones who first need to check with their primary care physician. They will most likely need an order to get the test performed at any of the designated testing centers. And the only ones that can actually are the healthcare providers and the first responders. I believe they can go to the University of Cincinnati's testing centers without a prescription from the primary care physician. Otherwise, you need an order from your primary care physician to get tested. If you have been exposed to somebody with the active disease and you're starting to exhibit symptoms, it may be worthwhile to make a case with your primary care physician so you can start the self-quarantining process. The second part of your question in terms of treatment. So again, in a patient with mild symptoms, the treatment options should be just simple, taking Tylenol for a little bit of fever, plenty of rest, and preventing others from getting infected. In severe cases, the only medication that we have so far approved by the FDA, again, there's not a whole lot of data on this. It is just anecdotal experience from the Chinese physicians, where hydroxychloroquine or chloroquine, this is an anti-malarial drug, and sometimes it's used in treatment of some rheumatological conditions, has been approved. It's a short course of 5 days. You start with a higher dose day 1, and the following 4 days you'll have a smaller dose. That has been recommended. I know one of the questions that was asked when we met last time on March 14th was the role of ibuprofen, also known as Motrin or Advil. So the jury is still out on that, and it is not recommended to decrease fevers in somebody who actually has symptoms of COVID-19. So ibuprofen is discouraged. The preferred medication to decrease fevers would be acetaminophen. Now, somebody who doesn't exhibit any symptoms of COVID-19 and just have little aches and pains, they can certainly take ibuprofen without any adverse effects. of course, check with your doctor. But specifically for COVID-19, the recommended medication to reduce fevers would be acetaminophen. The last part of your question about vaccines, the clinical trials have started. However, we are far from actually having it available to the masses, to the community. Typically, vaccines take a year, year and a half. So would be lucky if, let's say by fall, if we have a vaccine available. So at this time, we do not have a vaccine. We have trials that are undergoing, and I'm not aware of any trials going on locally.
Okay, so thank you for that. I guess I could just add, you know, when in doubt, call your primary care. A lot of them are even doing telehealth visits where they can see you over the video and decide what you need to do, whether you need to just stay indoors and self-quarantine, whether you need to get treatment, whether you need to get tested. So please do take advantage of that. And also, don't hoard the medications you think might work, because they should really only be prescribed by physicians who are actively taking care of this, because using those medications otherwise could probably even be dangerous. So
I'm glad you brought this up. It's very important. One of the medications that has actually been approved, hydroxyquinolone, is not a benign medication. It has serious adverse effects. It is responsible for what we in medicine would call dysrhythmias, which is abnormal heartbeat. And therefore, if you're going to be taking it, it should be under the supervision of a physician. It is not for everyone. I mean, for somebody who already has a heart condition, you shouldn't just be taking hydroxyquinolone that you borrowed from somebody, or so it has to be under the supervision of your primary physician.
thank you. Like I said, if you have questions, just put them in the chat box and we'll get to all of them as time permits at the end, okay? These are just some questions that we have. You know, can we bring the virus home from work? Or if we go to the grocery store, the hardware store, I mean, what are your thoughts on that?
Now, again, I'm going to refer to my previous session. A question was brought up, how long does it survive? And 3 weeks later, we know a lot more than we did. And 3 weeks from now, perhaps we'll be changing our recommendations. But one of the questions that was brought up, how long does it survive? The new data shows that it can survive actually on a metallic surface, such as steel, or on plastic for as long as 72 hours, as long as the conditions of the right temperature, the right humidity, the virus can survive as long as 72 hours. So given that information, technically, yes, it could be brought back from work or the grocery store. So the important thing is, as soon as you come out of the grocery store, as soon as you come back home, wash your hands, because how you bring it is typically through your hands. Avoid touching your eyes, your nose, your mouth, and wash your hands over and over again. That's the message. The healthcare workers obviously are at a higher risk of bringing it technically home. If you come across an asymptomatic carrier, yes, it is certainly possible. There was some talk the other day about a lot of people are out and about exercising, walking. You'd see people jogging. If you are close to somebody, really close in the park or something, and they're breathing heavy, you know, you can still transmit the virus. So yes, you can. And what can you do about it? It's those simple measures that we talked about, hand washing, and now we can add the face mask. So perhaps going to a grocery store, it's a good idea to have some sort of protective equipment, not an N95 face mask, but just a regular face mask. Is it safe to carry out food from restaurants?
Or even drive-throughs, add that in there.
Right. Again, it is you know, some restaurants, a particular pizza chain, they are making an all effort on no touch, and perhaps that would be the preferred restaurant. But if it can survive on plastic in ideal conditions, you know, you have to be cautious. So if you're handling it after unpacking, perhaps a good hand wash, a thorough hand wash for 20 seconds, singing your happy birthday twice, and a thorough hand wash between your fingers and your thumb, under your fingernails, with soap and water for 20 seconds would be the way to go.
Okay. So, you know, I have teens, you have teens, and they really can't understand why they can't just hang out if they don't have any symptoms. They're healthy. They can't get, even if they get sick, it'll be a mild case. I think I have this conversation at home every other day. So can you just explain why friends, teens really should not be hanging out, even if they're not sick?
Right. So remember, you can be an asymptomatic carrier and still pass it on to someone who can pass it on to somebody who is really sick, or who does come under the category of a high-risk individual. Therefore, any type of contact sports, such as basketball, soccer, or any contact sport, would be a no-no in a situation where we're trying to practice social distancing. I had a recent question about perhaps a golf outing, but then there again, we can keep our 6-foot distance, but there are so many other things in common. Would we be sharing golf clubs? Would we be riding in the same cart? There are many things that it can still spread. So till we know a little bit more, or till we are at the bottom of this curve that we're trying to get down, trying to flatten, I think we should avoid any type of gathering, even in a park. In our local park right here in our subdivision, nobody's allowed to go on the swings or any of the little, they have a play area for kids. So that's where we need to be heading. So any contact sports or any gathering of teenagers and stuff would be discouraged. With the way things are going on, with worst yet to come, God forbid, we will have situations where we'll have difficult situations. And I know you're part of the board, Dr. Sohail. Maybe you can shed some light about what type of plan does the Islamic Center of Greater Cincinnati have for a situation when there will be a funeral.
So yes, the board, in consultation with Sheikh Hussam Musa and Islamic Fiqh Council and scholars globally, have sat down, and we've set forth some guidelines which I would encourage everybody to read, but really it addresses how the ghusl will happen, how the janazah will be held, and the limitations on the numbers and the location and all of that. So what we've set forth is in accordance with what is happening with the recommendations of the scholars and what masjids are following for the most part nationally, if not globally. So, okay. So now here comes the $1 million questions. How long will this last? And will we be safe when this is all over?
Okay. In terms of how long will this last, again, the jury is still out on this. I was reviewing some data from countries in the Southern Hemisphere, such as Australia, Brazil, Argentina, and compared to the Northern Hemisphere, the number of cases, number of deaths are far less. So perhaps, and remember it's summertime or approaching fall time over there, perhaps there is a seasonality to this. Now, most respiratory viruses, especially the influenza virus, RSV, parainfluenza, these tend to peak during the winter months when when it's cold outside, when it's dry, that's when they tend to peak. So our hope is, though we cannot guarantee how this virus is behaving, that with the arrival of summer, perhaps we will see some decrease in the propagation of this virus, decrease in the numbers associated with new cases or deaths. We'll have to wait and see. But having said that, the question is, come fall, will there be another peak? Are we going to be prepared for this? We have to stay tuned and be in touch, with what the media has, the messages from the local health department. And that's right now, the recommendations are for April 31st. And that the social distancing and, everything has been kind of like shut down in a couple of cities. This is going to progress through April 31st. Towards the end of this month, we also start the holy month of Ramadan. And I understand that that's April 24th. And so all sorts of gatherings that we look forward to. Unfortunately, perhaps this year, they may not happen because of the current situation. So will it be safe? Not till we know more about it. Just stay tuned. Before we go into the audience questions, I had this last slide, and it just kind of gives a summary about staying home, practicing social distancing, getting adequate rest, eating a well-balanced diet, washing hands. The 20-second is really important. That's twice happy birthdays, singing twice while you're washing your hands, drying hands with a clean towel, covering your mouth with a tissue or sleeve when coughing or sneezing. Avoid touching the eyes, nose, or mouth. Clean and disinfect high-touch surfaces often. And I went over some of the products that you could use. I mean, they're commercial products. You could make them at home. If you want to get tested, or if you just have a regular appointment, check with your doctor, call, and good hygiene habits. I think you have another slide, Dr. Sohail, and then we can take some audience questions.
Okay. So I am getting a few questions, and I will just read them out. One question that has come in, I think you mentioned it a little bit, but do we need to clean the grocery items before bringing them in? Does keeping things refrigerated a few days make a difference?
The grocery items, they are protected it is the container that they're in. Perhaps you need to take them out and wash your hands. Now, if you're picking up some celery or cucumbers or tomatoes from the aisle, I mean, just perhaps washing them like you normally would. Again, things that you cook, cooking does, certain temperature will destroy microorganisms. So that should relatively be safe. So exercising good judgment like you normally would be the way to go.
Okay. Another question we've received is, we're learning about healthy younger population getting sick. What else can we do besides the common guidance? And I'll just put a plug. Tomorrow, Dr. Sabah Shaftai is actually doing a session on just dealing with anxiety and stress of this pandemic. And I'm sure one of the things we can do is to preserve our mental health and practice healthy eating, healthy practices. But what else can we do besides that?
Well, social distancing, like I encouraged, and I know that gets difficult, and that's where segues into Dr. Chaptai's presentation. It'd be really important. I'm going to encourage all parents to get their teens and try to maybe listen to what Dr. Chaptai has to say. I mean, it would be important how to cope with the anxiety, this social isolation. It'll be very important. So again, I would encourage all parents to get their teenagers together and maybe attend that talk. I think we're holding that session at 2 p.m. as well, and there should be a link available. So right now, the focus on some of these little images that I had, social distancing for the younger individuals, a good hand washing, staying at home, practicing good hygiene, health habits, washing your hands frequently, etc. This is the way to go. There isn't any prophylaxis in terms of medications or anything that you can take to prevent it at this time.
Another question I have is, can you speak to the fact that the regular cloth masks do not protect in the case of being exposed to particulates? They protect in case the person wearing the cloth mask has symptoms, so they are not infecting others.
Right. So the mask is to prevent, the mask is, if you are an asymptomatic carrier and you happen to cough or sneeze when you're out in the grocery store, out and about, it is to prevent the other individual around you. So the mask is not an N95 mask. There are special masks for the medical professionals that they would use when they're taking care of patients who have, there's something we didn't really get into the technical aspect. There's something called an inoculum. You have to have a certain burden of virus that you inhale, which makes a big difference. So if you're carrying a risky procedure, carrying out a risky procedure, a medical procedure in a hospital setting, you're at high risk, and therefore you need to be well protected. You've heard the word PPE, personal protective equipment, and that involves, for a healthcare individual, an N95 mask, and in some situations, PAPRs. These are kind of a negative pressure mask that are used. So, but for the general public, the regular mask, the cloth mask that is being recommended by the Centers for Disease Control, is to prevent the virus from spreading from an asymptomatic carrier or an individual to others.
Okay. Another question we have is, after the stay-at-home orders are lifted, would it be advisable for centers like ICGC to open its door right away, or would it be advisable to wait for an additional 14 days before opening up to the community?
I would tend to go with the latter. And it would have to be still in some form of, like, we can't really have 1,000 people to celebrate that, okay, the orders have been lifted and then we can go. I think it should, again, common sense should prevail depending on the situation. I think it would have to be gradually phased in.
And just to add to that, the Islamic Center, the Board of Trustees, especially the Executive Committee, we, in consultation with Sheikh Hussam and Executive Director Henry Hain, we discuss these issues regularly. And we, when we close the doors, when we shut down activities, we were ahead of the curve. And when we resume, we will really only do it when it is safe for everybody, inshallah. So that was the last of the questions. I would like, if anybody else has any more questions, feel free to either post them or ask us later if we can get to them. But otherwise, we'd really like to thank Dr. Siddiqui for making himself available, answering these questions, and really putting some of our questions and minds at ease. Once again, this is the dua for protection. Sheikh Hussam does a beautiful nightly khatira with Quranic recitation, and I encourage everybody to subscribe to ICGC's YouTube channel to hear those. And we hope and pray that everybody does stay safe and healthy, and inshallah, we resume life as it was after this is all behind us, inshallah. Thank you again, everybody, for joining. And remember, tomorrow at 2 p.m., Dr. Saba Chukhtai, a local psychiatrist, will be giving us a session about the anxiety, the depression, the stress, and all of that related to what we're dealing with right now. So thank you again.
Thank you, Dr. Sohail, and the audience has been wonderful, fascinating questions, wonderful questions. All I can wish for everyone is to be safe, and inshallah, we can have another update in a couple of weeks from now and see where we need to be heading. Thank you, Dr. Sohail.
Thank you.